All right, I'm here with Dr. Bijal Patel, the CEO of Balboa Nephrology here in San Diego. Balboa Nephrology not only has a large footprint in San Diego and SoCal, but also is a very innovative practice. So I'm here to meet with Dr. Patel. How you
Hey,
doing?
nice to see you, Cassie.
Yeah, we're here at their Transitional Care Unit, their TCU. He's going to go over what a TCU is. Bijal, tell us a little bit about yourself, man.
My name is Bijal Patel, and I've been practicing nephrology for 17 years. I've been overseeing our home program at Balboa Nephrology for almost 17 years. We're looking to push the envelope on anything that changes uh, kidney care for our patients.
Well, where I am right now is their TCU, the Transitional Care Unit, and this is beautiful. This is one of the larger dialysis facilities I've seen. Tell us exactly what a TCU is.
So TCU is, again, stands for Transitional Care Unit. I would look at it as a stabilization point for our patients that crash onto dialysis or just are not sure about what they want out of dialysis. And the way I would think about this is we're just moving the decision point of how you want your dialysis to look, whether it's at home or in a center, from the time you start dialysis to 4 weeks later. So during that 4 weeks, we give patients a chance to really just think about what they really want in a less fearful, less urgent manner. It's also, our patients want quality of life, and their family members often want safety. Yeah. So this is a chance to address both of those things so that patients and their family can truly get what's best for them in their dialysis
care. So
care.
this is really meant for that patient that really doesn't know what they want, or is scared, or is just getting started in dialysis, right?
That's the highest yield, but I'll be honest, I think every patient can benefit from this. But if a patient's already decided that home is the best place for them, they can go directly to home. They don't have to go through the transitional care. I think the transitional care, again, just allows for some of the barriers of the logistics and the patient to kind of be addressed in a manner that is not done in the hospital or in a quick
and we just got a huge presentation, and you guys give all the support here, right? The social worker, the dietitian, the family support. Yeah. That was like one of the big things your facility manager talked about, right?
Yeah. Medical is just one of them. It could be financial, social, transportation, stress, work, all those things. So how do you do that if you only have just the doctor?
So rather than someone crashing into dialysis or being rushed into dialysis, someone who doesn't know, who is fearful, they can come here and essentially get almost like a home dialysis session in a center. Is that right?
Yeah, so we're doing 5 days a week of a home hemodialysis session for 4 weeks. Okay. At any point, if the patient decides, I want to do home hemo or PD, we then put them on a path towards that. And so they can still stay for the 4 weeks, but we can still start addressing some of those things, like whether it's cannulation training, self-care, or getting a PD catheter, or if there's insurance barriers, we can address those things during that time. It also gives the family a chance to kind of figure out what are they going to do, because this is like really a tornado for the family.
Yeah, no, absolutely. And so this is not something that's common in kidney care at all. Like this kind of unit is not. So what do you think it takes for a practice to actually make a transitional care unit? How do you make one?
Yeah, so I think look, it's expensive to do this.
Yeah.
But it's the right thing to do. I think you do probably need some critical mass of patients and physicians. Like, so if you're a 2 or 3 person group, it might be difficult, but that doesn't mean you can't partner with other groups in your area to build something like this. I think that this is a game changer for our patients and for our community. And so I think it takes, a commitment to doing the right thing, leading with values and a long-term outlook. If we just think short-term about the cost per treatment or what exactly we're doing for the patient that second, we're going to miss out on some of the potential benefits.
Yeah.
And so
you're like essentially bear the front end cost because the long run is a better horizon for it, right?
I think so. And I think if you're in more value-based care kind of agreements or outcomes-based models, whether it's with payers or Medicare or with your healthcare system, that's when everybody can win. So if we stick to just fee for service, it's going to be tougher. There'll be that financial burden that might be difficult to overcome.